This is my topic of breastfeeding and its effects on children and mothers. My research topic is regarding breastfeeding and the effects that it may have on a mother and her children. I wanted to evaluate the benefits and negative outcomes of breastfeeding a child versus formula or a mixture of the two. Although breastfeeding is a natural thing that women's bodies are made to do, some women choose not to or are not able to. And as I've gotten older and more aware of myself and who I am, I've questioned if my lack of intimacy with my mother as an infant would have had any impact on my trajectories in life. Breastfeeding a child is very sacred and an intimate situation between a mother and her child. And I've always been under the impression that women who are physically closer and give more loving touch are closer to their children later in life. Initially, I searched for research regarding the emotional connections between a mother and her children later on in life after being breastfed. However, I was unable to find any research for this topic. The psychological aspect of breastfeeding was what I was concerned with to begin with. However, when I began to research, I saw that the physical impacts of breastfeeding were great as well, and also for a research study to be able to check back in with participants some 20 years later, that would have been a difficult task to accomplish. My research question is, what are the experiences of women and children in regard to breastfeeding? A theoretical framework that was used was in my bed sharing article, and that was a phenomenological framework to analyze the results. And this was the only article that stated a theoretical framework that they used. The designs and methodologies of my studies, one study was an interventional study, two were cross-sectional, one was a quantitative modeling method, and one study was qualitative. Lastly, one research was a retrospective analysis. My early initiation and exclusive breastfeeding article evaluated factors such as age, education, employment level, family structure, planned pregnancy, breastfeeding education, etc. And all of the mothers were in a specific hospital and were educated equally on the benefits of breast milk. And then 6 months later, there was a follow-up for each of these mothers to inquire about their feeding practices since the birth of their baby. For my infant and young child feeding practices interventional behavior article, they used a baseline survey, and it was given to the subjects, and then an interventional education program was developed that was given to educate these mothers based on their initial survey results. After the interventions, there was a reassessment and follow-up interview to determine if the interventions were effective. In the bed sharing article, the study was conducted by evaluating 6 mothers who were known to have breastfed and bed shared with at least 2 of their children, and this study was conducted by interviews regarding their thoughts about bed sharing, how it's impacted them, and how their breastfeeding experiences have been, and the interviews were recorded and then analyzed. On my childhood obesity article, this was done by having parents fill out a 147 questionnaire regarding the physical activities of their children as well as their height and weight. The latent trajectories of infant breast milk article was used by taking an initial sample that was focused on infant feeding, sleeping arrangements, health of the mother, enrollment in WIC, and mother's dietary intake, and then after 6 years, the same available participants were evaluated regarding the health of the child and the mother. In my acute kidney injury article, this was an article that was or a research that was done on an analyzation of health records in India of babies who were less than 2 months of age and required admission or had a documented hypernatremia or damaged kidneys. And the factors that they evaluated were age, sex, place of delivery, breastfeeding, symptoms, AKI staging, and other factors, as well as their outcomes, and they were taken into account when they evaluated these records. Some of the results that my studies found were 97% of mothers who initiated breastfeeding and 60% were within the first hour of birth. Exclusive breastfeeding was maintained for 6 months in only 38.9%. Early cessation of breastfeeding was associated with low education level, nipple problems, bottle and pacifier use, and lack of social support. Antepartum education was the most important factor for exclusive breastfeeding. Mothers who bedshare and breastfed had better sleep, easier night care for children, and more confidence in their parenting. Children who were fed formula only or a combination for less than 6 months were more likely to be overweight or obese in comparison to those who were exclusively breastfed. And when comparing the overweight versus obese children, they showed trends of the obese children being mostly only formula fed. It was found that mothers who breastfed had lower BMI, lower incidence of breast cancer, and children were less likely to be sick who had been breastfed. Out of the 16 infants with AKI, 13 were exclusively breastfed, and the other 3 were on mixed feedings. Some limitations that the studies had during their research was that the responses to some of the questionnaires were self-limited and could have led to over and underestimation of breastfeeding practices, and some of the studies were unable to determine prior knowledge, attitudes, or interest in breastfeeding from the subjects. There was no control group in most of the studies, and there was a short period of time before follow-up in one of the studies. Surveys were not all-inclusive, and there was a lack of determining maternal weight status, quality of child's diet since birth, timing of introduction of solid foods, and the genetic predisposition to obesity, and that parent reporting is prone to error and it could have been biased in the childhood obesity article. Some recommendations made by the research authors were that studies should be done to clarify breastfeeding duration rates, factors that may affect breastfeeding, and interventions that can be done to increase these rates. You should have a control group and a longer duration of time to determine sustainability of the interventions. Public policies regarding infant sleeping arrangements should be inclusive of families who bedshare, and to study AKI in a large group of breastfed babies who have no other predisposing factors. My self-recommendations for research would be have a questionnaire that is done in the prenatal visit in order to determine these mothers' thoughts and plans about breastfeeding for a comparison after birth. Use larger sample sizes in a control group. If there were mothers interviewed who breastfed that do not bedshare and mothers who bedshare who do not breastfeed, I believe that would be a good research topic. Mental health and psychosocial attributes should be studied in regard to mothers and children, and the frequency of feedings of breastfed versus formula-fed children could be a factor that would be necessary to evaluate to eliminate another reason for obesity. And they should evaluate babies who have AKI who were not breastfed, if there were any, and compare characteristics with breastfed babies. In the discussion bringing all this information together, it was found that the education level, nipple problems, bottle and pacifier use, and social support were big contributors of why subjects stopped breastfeeding early. The awareness of hygiene, feeding practices, and proper diet were all significantly increased after educational interventions. Bedsharing was a positive and beneficial experience for all of the mothers interviewed who breastfed. Children who were formula-fed more frequently were less likely to be obese or sick, and positive health benefits were found to result from breastfeeding 6 years later in life, and breastfeeding was found to be a contributing factor of acute kidney injury in young infants. So this was the one negative of these research articles. For breastfeeding, it seems for the most part to be a positive way of feeding newborns due to mother satisfaction and confidence, health benefits for the mother and baby, and lower incidence of obesity in children and healthier lifestyles overall. It was also shown that breastfeeding can be a possible risk for kidney abnormalities, and that is the one negative that any of these articles really said. Overall, breastfeeding appears to be beneficial and a safe way of feeding a baby as well as cost-effective, and the benefits of this practice outweigh the negatives, and mothers across the globe should be educated on the benefits, given the proper information, so that their children receive the best nutrition possible.